Hey guys, my name is Hopkins Lang and welcome back to another YouTube video. I'm a qualified sports therapist and currently studying my master's in physiotherapy. And for today's video, I'm just going to be showing you guys how I assess one of my clients. So please introduce yourself.
Hi, my name is Shazia James.
Alright, great. Shazia, so talk to you. What's been going on?
So I do like a lot of weightlifting, a lot of stuff on a day-to-day basis, and my back hurts a lot. Mostly like the upper back, near my shoulders, my neck area. One of my scapular bones, I think that's what it's called, is more like higher than the other, and my shoulders needs to be a bit more shorter on this side, so I think it's quite tense, like the muscles that's over there, and it just causes pain, like an ache all day, like every day.
You said when your scapular bone is shorter than the other. How did you? Do you see it? Someone tell you? How did you know?
Yeah, so I was just wearing like a vest top, and my mum just saw it. She was like, "Your shoulders look very like unlevel."
Yeah.
Unlevel. And then I said to her like, "It's always in pain." I used to rub DP on it every day. I didn't really think anything was wrong with it, but yeah.
Why did you rub DP on it?
Because I just had like muscle pains, but I just thought it was from the work that I was doing, not necessarily like my muscles being tight or anything like that.
How long has that been going on for?
Probably about 8 to 9 months now.
Okay. And was there like any specific incident that caused it to happen, or did it just creep up on you one day? You just suddenly felt it?
I think it's just probably from the work that I was doing on a day-to-day basis. I fell off a horse, and I landed on my back, but I didn't think that injured anything because probably would have been a bit more painful than that. But yeah, other than that, no injury.
So you fell off a horse. Like, what were you doing on the horse?
I was riding.
Just gotta make sure it's not a common thing. Remember when you first mentioned it to me? I was like, I've never met anyone who does that. You horse ride and you take care of horses. Explain more about that.
So we just look after them on a day-to-day basis. Even just stuff like just grooming them, exercising them. It's a lot of work.
Yeah.
When you have like more difficult horses, so you have to run everywhere. It's a bit more like effort and energy that you're putting into them, and just cleaning their beds, just tidying up their environment as well, and then just do riding occasionally.
Yeah. Okay. So I mean, you just telling me all of that seems like very, very demanding. Horses are strong animals, and since you have to do so much cleaning and moving around stuff like that, I can see how it can be quite strenuous. On a scale between 1 to 10, so 1's the lowest and 10's the highest, how painful is the pain in your shoulders?
I'd say like a 7.
7 out of 10?
Yeah.
Even at rest or when you're moving?
Even when I'm resting, so I found that when I even go to bed and I'm literally just not moving or anything, I can still feel it hurting, like it's an ache.
Is there like a pattern to it? So do you feel it in the morning or is it mainly at night?
I'm not really sure about the mornings, but because I don't really think it's as painful in the morning, or else I would actually remember. But at night, I do like twist and turn, feeling it. So, yeah.
Is it more so a thing after like a very active day? You'll feel it at the end of the day?
Yeah, or even during the activity, like it'll be fine, and then once I start doing something, I start feeling it again.
What sort of activities?
Like movements, but it will be like lifting something, or even like pulling doors, or even like doing my hair. Just like simple things that consist of me like moving my hands and actually putting a bit of pressure on it.
Yeah.
After a couple minutes, I'll start to feel pain again. It'll just stay from the day.
Does the pain just stay at your shoulder blades, the scapular region, or does it go elsewhere around your body?
It's mostly just the upper back and just like in my neck.
Into your neck?
Yeah, just there, just my shoulder.
So what eases the pain?
Nothing really. If I start to like rub my back, I don't know, it kind of feels like I'm having a massage, but once I let go, it starts to hurt again. So it's just kind of like a relief there, but temporary.
That's basically a concept called pain gate theory. So when you rub it, so let's say for example, you have pain right now, and when you rub it, it activates other receptors in your body to basically slightly nullify that pain, so you don't feel it. But as soon as you remove the hand of it, then the pain comes back basically. So that's why whenever you bang your knee, you rub it, it feels a bit better, but as soon as you take it off, exact same thing. You're just tricking your brain a little bit, but your body does a lot of things subconsciously what you realize it basically, and that's one of those things. And apart from any movements and sleeping on it, is there any other thing that aggravates your back?
No, not really.
Okay. Have you been taking like any painkillers? You did mention DP. Have you been taking any painkillers, any other types of medication?
No other types of medication, just DP. I stopped taking it over the summer, but I use it like every morning and night consistently for about 3 months before my mum realised that my scapulars were unwell.
And have you gone to see like a doctor, physio, anyone prior to this?
Yeah, I went to see a physiotherapist at my doctor's surgery. He gave me like a 8 to 12 week program of stretches. But because I injured my right hand, I wasn't able to basically carry on with those and didn't feel like it was helping anymore.
Was it just stretches?
Yeah.
Okay. What sort of stretches, if you want to show?
Kind of just like lifting.
Yeah.
But without putting any like, so basically using this hand to lift this hand.
Yeah.
Whilst it's like quite relaxed. I can't remember any. I think there's somewhere I had to put my hand behind my back also. But yeah, when I went to him, he didn't see anything with my shoulders. Like he didn't. When he looked at it, he said there's nothing wrong. Like there's nothing. I'm never or anything. So.
Yeah. Did he? You saw him face to face, yeah? Yeah. Okay, good. And did he assess your strength?
No, he just assessed my movement and what triggered pain. But I was trying to explain to him that it's not necessarily just you touching it or me like doing like moving my hand and stretching that's gonna trigger it. It's just when I do start meditating.
Yeah. Because from what you've told me, you're quite active.
Yeah.
And a lot of the pain-inducing stuff were you actually exerted force.
Yeah.
So you doing lifting, you pushing, those are a lot of like muscle activities basically. So, because potentially right now, so this is me just thinking about potential injury you might have. So it could be tightness or weakness around your muscles. Yeah. So it could be your upper traps, it could be your rhomboids regions, it could be your shoulder muscles as well, so your deltoids. But it could also be due to, so you see your scapula? Yeah. What it does is linked by so many different muscles. So for example, if one's elevated, that means when your muscles is not activated properly or is weak, hence why it's slightly elevated. Yeah. So I need to see which muscles are basically causing that imbalance, if it is that. Because you didn't have that before, right? Yeah. Okay, that's good. Has this affected like your everyday life?
Yeah, when I'm sleeping, I feel the pain, so sometimes I'm just gonna turn a bit. Or even when I'm just at college doing stuff with the horses, I'm quite slow or I have to take a break sometimes. Because it kind of starts to like sting. Like
starts to sting?
Yeah, I don't know, it's like a sharp pain, I should say. When I'm doing too much, I have to stop, kind of let it relax and then just do it, like start again. Have you ever had like a burning sensation? Tingling, numbness? Not that I can recall.
Okay, good. Does the pain ever go down your arm?
No.
Okay, good. I was just trying to rule out any nerve problems. So your nerves are fine, that's good. And you said it hurts you when you sleep, but it doesn't prevent you from sleeping, right? Okay, good. And would you say that, are you a bit more stressed currently? Because of like the pain, but also like carnage on work and everything?
Yeah, a little bit.
Yeah? So more than before?
Yeah.
Okay, do you think that's been potentially affecting your pain or?
I'm not sure, I couldn't make a link to be honest.
Yeah, it's alright. And have you had any previous injuries before?
No.
No?
No.
Okay, good. Alright. So, okay. Alright, let's get into the assessment. So the assessment consists of me doing, so this is the subjective assessment right here. Me asking you questions, trying to get a bit more history about your injury, how it's happened, and also now we're going to go to the objective assessment. This is where I'm going to move your arm, assess your muscles, your strength, see your flexibility, do a few different tests, then I'm going to give you treatment. So treatment's going to be a massage or mobilization, just trying to move your muscles, and then I'm going to give you exercises, so stretches and exercises, which will help you strengthen up your muscles. Alright? And now I'll be performing the objective assessment. I'll be starting out by checking to see Shaz's active range of movement. Active range of movement is when the patient moves the joint themselves. Just checks to see the muscle's ability to contract, and I'm also looking for the quality of movement and also if any pain is being reproduced. So the shoulder is able to perform shoulder flexion, extension, abduction, adduction, internal and external rotation, retraction, protraction, and elevation. I'll be checking to see those movements from Shaz. And again, like I said before, just checking to see the quality of the movement. And after that, I'll be performing passive range of movement. So passive range of movement is when I move the shoulder joint myself. So I'm moving it into flexion, extension, abduction, all of the movements I mentioned earlier. And the reason being so that I'm checking to see the quality of movement and also if any pain is being reproduced. This is the shoulder, right? Yeah. Come a bit closer. See if I can get on camera. Okay. Alright. So you basically have a wing and shot, a scapula. So it's just sticking out basically compared to this one.
Yeah.
I can literally just poke it in there.
Yeah.
Does that? No, it just feels a bit weird, right?
Yeah.
My bad. Yeah, so I want to see you. So raise your arms up. Yep, and if you look here, it's basically the musculature compared to the left side. So this side's got a bit more musculature compared to this side. Back down. And I want you to raise your arms like this. Look at me. So, yep. Hold it all the way to the top. Hold it. And you can see with your scapula. So this one, it goes here, and the other one's here.
Yeah. Basically.
Okay, back down. And now the last one, I want you to basically reach out forward like that. Back down. Do it again. So like this basically. So. Yep. Hold it. See if again this one goes faster than that. Just going to strengthen up the muscles here so we can put it closer. Bring it back down. Back down, so yep. We basically strengthen up your muscles here, so your rhomboid regions, so we can pull it back a bit more. But I'm also gonna see what other muscles that could potentially be weak as well. Okay, back there. So now we're gonna do the strength test. So we're just gonna do resistive flexion. So resistance test is basically I'm gonna apply force.
Yeah.
I want you to still go through the movement.
Okay.
Yep. Alright, go. All the way to the top. Stop. Do it again. Keep this arm straight. Yeah. Once you start to bend that arm, you activate your biceps. Go. All the way, all the way, all the way. Okay. So we have to scale that. So there's a scaling system between 1 to 5. So I'll give that a 4, 3 to 4, around that region. Reason being, you weren't able to get it all the way to the top cleanly. All right, so let's try it one more time. Go. All the way, all the way, all the way. Better. Now this time, just bring it back. Good. Now we're going to the side. Go. Arm straight, arm straight.
This is what I was thinking.
Okay. And now we just basically try and shrug your shoulders. Again. Awesome. Alright, arms to the side here. So come here. Okay, so what I'm going to do, face me. Arms up, hands on that. Try and do that. I'm going to. Look, keep your elbows tucked in and do this. So do it. That's it, good. Back to me. I'm just going to back for a second. Go. How's that? Which side's easier? Yeah. Inside. Go. Okay. I'm just going to ensure clients comfortable all the time. Okay. And now I'll be performing the massage. So when I was going through my assessment and also palpating Shaz's back, I felt a lot of tightness. So I wanted to relieve the tightness, but also help to increase the range of movement around her shoulders, but also around her back. The massage will help Shaz feel a lot more relaxed and loose, and this will help her sleep a lot better, but also help her perform the exercises easier because there's going to be an increase in mobility out of shoulders and back. Okay, so now we're going to get on to the exercise portion. So what I want you to do basically, I want to strengthen up your external rotators, your internal rotators, the muscles around your shoulder blade, so we can put it back into position. Also around your arms as well, so shoulder, you're showing this movement, this movement, and going to the back as well. So this, give this to you. So you're going to need to do some exercise at home. So first we're going to do, step on it, and up and down. Yeah?
Okay.
Try to do that. If it's too heavy, I'll change the color of the band. Too heavy?
That's alright.
That's alright? Okay, good. Why don't you do 10 of those?
10?
Yep.
Okay.
You scared?
I just did 3.
Okay, good job.
Well, how far do I go?
Go to where you can, basically. Good, that's it. and then we can progress that, but this is the first step. So make sure you do 10 on both sides. Alright, so next one, it's the same thing, except this time you do an abduction. So you step on it, here, boom. Alright?
Yeah.
It's all about having good form as well, so you're mainly focusing on your arm muscles, so your deltoids.
Okay.
Try that. That's it. I want you to do it like that.
I can feel that it's like proper weak though, like.
And try not to lean as well.
Oh.
See, you're leaning a bit. There we go.
There's no way.
You see it?
Struggling.
Okay, so there's that position. So you stabilize this arm right here, and then you externally rotate this one.
Okay.
Yeah? Try that. Try to keep this. That's it. How's that?
That's alright.
Alright?
Yeah.
I want you to do one at a time, because after that you can just do both at the same time.
Okay.
So just get used to the movement basically. Yeah, try that arm now. Make sure you do both arms as well so you don't neglect one.
Okay. This arm is harder.
Yeah. So this is the T.
Yeah.
Right here, yeah? See how my arms are to the side like this?
Yeah.
Try and do 8 of those. And what you do as well, what I want you to do, I want you to bring your arms like this. Now you see how I brought my shoulder blades back? That's it. Bring your shoulder blades back. Perfect. Now raise your arms. Good. Perfect. Don't lose that tension, so shoulder blades back. Good. And do 8. And the same thing. So bring your shoulder blades back.
How am I supposed to?
Same as before. Just retract your shoulder blades. That's it. Now raise your arms up.
Oh my god.
So that's the Y.
Oh my gosh, that's too much.
Does it hurt?
It's hard.
Good.
So up.
Perfect. You feel that?
Yeah.
Good.
Is that it? And then I have to relax. It's like clicking every time.
Alright. So that was the end of the session. So from my assessment, what I can diagnose you with is that you basically have scapular winging. The muscles around your scapula are a bit too weak. From the resistant range of movement assessment I saw, from what I've done, so that you won't be able to really get through the whole range of movement. You're struggling a bit, and I can see that you've got a bit of weakness around your muscles, especially your deltoids, triceps, and also your rhomboids region. And to the extent as well, your levator scapula as well. This helps you to bring your arm up. So the exercise I've given you is going to help you strengthen those muscles, and that should correct also your posture of like your scapula. So put it back in place so that it's not coming out to the side, it's a lot more stable. And this plan I'm giving you should last you 6 weeks basically. So within maximum 6 weeks, you should start feeling a lot better. You start feeling better every week as you'll get stronger, and you'll see that your posture's going to improve, you'll be less pain. So I want you to stick to it. I will give you a different color band as well. You can keep what I gave you now.
Yeah.
I'll give you another one so it's a lot easier. And I also made the plans harder for you. Yeah? Happy?
Yeah, thank you very much.
You're welcome.